CDC now says testing on the Louisiana patient hospitalized with a severe case of H5N1, commonly known as the bird flu, finds the virus likely mutated in the person after they were infected.
Basically, the situation is that there's a lot of H5N1 in the U.S. It is being spread to humans via both cows as well as poultry and wild birds. And this has created essentially a nationwide risk for human exposure.
According to the CDC, the mutation means the disease could potentially become more transmissible to humans, but there is still no evidence this strain has been passed on to anyone else. All right, let's bring in Dr. Huaijun Zhou, a professor of animal science at the University of California, Davis College of Agriculture and Environmental Sciences. Doctor, thank you so much for being with us today. According to the CDC, there are currently 65 confirmed cases of the bird flu here in the U.S., and that case out of Louisiana that we just mentioned is the first severe case so far of the illness. That said, should we be concerned?
Well, for sure, there's, more of those virus passed to the other species, like the cow, which previous not able to infect the dairy cow. So, because basically the virus, when the virus infects the host, they start to replicate it. That's how happened of the mutation could generate it. So I have a more transmission potential, more mutation, and then the mutation depends where are those mutations generated. That's how could those virus can be, infect other animals, other species.
Yeah, you mentioned the cows. I know there's concern about drinking raw milk. Talk to us about that.
Yeah, basically, because basically the virus replicated in the host, such as dairy cow. So, and then potentially those virus will be replicated in the milk. And then if the milk don't pasteurized, and then virus could potentially pass to the human.
Yeah, and I know in Canada, excuse me, doctor, there was a case of a teen who was tested positive for the bird flu and was in critical condition due to respiratory complications. Do you think this is something that could potentially become an epidemic or pandemic, or are these simply isolated cases in humans?
Yeah, in general, for the current situation, still it's isolated case because haven't seen any of the data those virus can spread from human to human. That's the pandemic, So the only basic transmission current is from, infected cow to humans, or infected chicken, and when the people, interact with the chicken infected with avian flu, that's how human get sick.
Yeah, and before I let you go, for those who are concerned, and many are, what should we look out for? What are some of the symptoms of bird flu in humans?
Well, it's similar like the regular flu. So basically, any respiratory, symptom like a sneeze, headache, fever, cough, all of these, it's a similar flu symptom.
Yeah, and what should people do if they think that they have it?
Well, I think first is definitely they need to go to the hospital for the exam. So because the hospital clinic can test what kind of strain they have.
Okay, Doctor, thank you so much for joining us today. We really appreciate Dr. Huaijun Zhou from California. Thank you.